that your $1 investment, is equivalent to that. But again, having said so, it's not something that is easily seen. All right, it's an investment over the years. And that will happen as we make that investment. The economic situation will improve, the standards of living will improve, the longevity of life, within our society will improve. So we have challenges. Those of us who are in government, I need to tell the truth to our governors, because often those who are around the governors, tell them what they want to hear. And we have a responsibility to tell them what is right and what is best for our communities.
Thank you very much, sir. The next question. He asked about wonderful policies, and then when it comes to funding, it stalls. So what can be done?
Okay, thank you very much. Probably before I go to that question, just to add a few things to what Honorable Commissioner said with regards to the issue of prioritizing the issue of infrastructure over making the health system work. Like a couple of months ago, I was with the Honorable Commissioner. We presented the result of service availability and readiness assessment, which shows that more than 80% of the facilities were not functioning in that state. And the response I got from the Commissioner was that, oh, His Excellency is thinking of building 18 additional secondary model hospitals. And I said, Honorable Commissioner, why can't we make the existing one work? But what I'm trying to drive at is that we have to change the narrative. We have to listen. We have to be empathic in our communication and listen to the political class as well. Average governor is looking for a political mileage. He's looking for political capital, which he feels is going to get by building additional structure. It is now left to us to change the narrative, to make multidimensional case for health investment, to let them know that health investment it's not until when you build additional hospitals. If you make the existing one work, you can get political mileage as well. You can get return on investment in terms of economic investment. It can produce jobs. It can reduce poverty. We are shortchanging ourselves in the health sector by not making elaborate case for health investment. I think that's very, very important. Then, with regards to the second question?
Yes, about policies that are not being implemented because of money.
Okay, a very important one. And part of the study we do in our project is that why are policy not being implemented? At times we feel it's only funding that militates against implementation of policy. At times the design of the policy itself is dead on arrival. There are some policy that is not possible to implement it. There are a lot of policies that are hanging on the shelves. Nigeria has a lot of policy documents. There's virtually nothing you are looking for that you will not get. But what is the process of design of this policy? And again, we often forget that policy making, there are three important aspects of policy making. There's political, there's ethical, and there's technical aspect of it. Often we start from the technical aspect of it. Donor partner come in, let's have a policy on health financing. Let's have a policy on strategic one. They engage a consultant. He sits in the corner of his room, write 200-page document. Most of them dubbed from Rwanda and all those stuff like that. And you are expecting somebody to implement this policy. It will not just work. You cannot separate politics from policy. Policy making is fundamentally political. I was in the state. Somebody is developing state strategic development plan for the states. And I was asking, what is the input of the Mr. Governor on this? As he does not know anything about it. Okay, you are developing a plan about how the governor will spend his money and does not know about this policy. So we have to look at critically how we develop policy in this part of the world. And again, there are fundamental flaws in how we develop like a strategic plan. Somebody will say this is a 5-year strategic plan. For God's sake, if immediately you finish the plan, the situation, the context has changed drastically 2 months after. So we have to embody the principle of dynamic policy making. The policy have to be very, very responsive to the situation on ground. So don't let us look at it as if the issue of only funding. There are a lot of issues. Political will is very, very important. Ethical consensus. When we are talking about policy making in the public sector, let's say, for instance, universal health policy, the underpinning issue in universal health coverage is equity. We need to have social value of equity before the policy of equity will work. I need to know that that woman in the village is a human being and is the fundamental right to have access to health. Those are the fundamentals. So let's go back to the fundamentals before we look at, okay, probably the only issue of funding. I think it's far beyond funding, but I agree with you, funding is very, very crucial. Thank you.
Please, a round of applause for all the panelists. We've actually come to the end of this panel. Please, I'm inviting Ambassador to give us some announcements. Meanwhile, they will take group photograph.
We should have taken lunch at 1, but you didn't even care about that. That shows how much interest you have in making sure that health system works in Nigeria. And I think we'll have gradually getting to the close of business of the day. Tomorrow we are going to start. From me.
Is it from the? Okay. This is the two. Announce it. Very, very important. Announce the speakers.
Where is it? Okay, tomorrow we're going to start by 9 a.m. We also have our repertoires, and we would like people to volunteer to join the communique drafting committee. To join the communique drafting committee, because at the end of this particular national dialogue, we're going to have a position paper that will be sent to all the stakeholders in Nigeria and beyond. So tomorrow we are going to have that is day 2. We'll have a panel discussion for state commissioners of health, and one is actually here waiting for tomorrow, and it will focus on primary health care delivery at state level. We're also going to have another panel discussion on cancer survivorship, a critical issue in universal health care coverage, and we're going to have some cancer survivors and technical experts come share their experience. We're going to have also a panel, the interministerial coordination for health sector, financing experiences, challenges, and way forward. And the Honorable Minister has assured that he will be here personally to participate in this section. We're also going to have the last but not the least panel on media advocacy and accountability strategies for achieving the universal healthcare coverage. So it's very important. Honorable Mohammed Usman, Dr. Zainab Bagudu, Chief Muji, MON, Mr. Ronsi Chidebe, Gloria Oji, Marcos, and then also we have the Honorable Minister in the next section. We have also Mrs. Adekemi. We also have Senator Udoma. We have Dr. Habiba Lawan. We have Dr. Daniel Iya. We have Mr. Mohammed Jamil Zakari. We have Bayo Onanuga. We have Semba Iyage. We have Mr. Dakbo Olu. We have Dr. Ifeanyi M. Nsofo, and the Managing Director of Daily Trust. Now, these are the people that will graciously be in the panel tomorrow to provide insight on what we are going to be doing to move forward. If you think that we have had a productive day and we have done something about making health system work in Nigeria, join me in standing up and putting our heads together for all the partners and all the members of the audience who have made this to work today. Premium Times, Project Pink Blue, PACFaH, Bill and Melinda Gates Foundation. Thank you so very much for your patience and active participation. We shall now proceed to have our lunch break. And after that, we'll have a beautiful evening while we keep meditating on how national healthcare coverage will thrive in Nigeria. So thank you, and God bless you. See you tomorrow.